At Ohio State, where we have a large experimental therapeutics program in CLL of many years, of many years duration, we have been particularly interested in small molecules that are targeting downstream kinases of the B-cell receptor. So there's an understanding in CLL biology, now several decades old, that B-cell receptor signaling is important in some context. At least that's been reasonably well understood. But I think the advent of drugs that target the kinases downstream of the B-cell receptor have really suggested the clinical viability of that strategy. So here we're talking about drugs that target the spleen receptor tyrosine kinase, or SYK, the Bruton's tyrosine kinase, and the PI3 kinase delta isoform, which is expressed primarily in B lymphocytes. Drugs to target all three of those agents are at various stages of clinical development, and two have actually reached approval over the last 16 months. The first, ibrutinib, for the inhibitor of the Bruton tyrosine kinase, entered clinical practice for CLL in February of 2014, and idelalisib in July of last year, 2014, both for the initial indication of relapsed CLL, where the need was perceived greatest and the initial investigations were undertaken.